Hey everyone, so today we are going to talk contraceptives and everything about them from the pill to other methods. So let's get started. First, let's define what is contraception. Well, it's also known as birth control, or more commonly known as birth control. The bottom line is that contraceptives work to prevent pregnancy. Now, oral contraceptives usually contain two types of hormones. These are estrogen and progestin. So these hormones are essential in fertility and having menstruation and the regular bodily processes of biological women. Now, the way that birth control works is through usually multiple methods of action, and it depends on whether it is estrogen dominant or progestin dominant or through some other method. But the ones we're going to talk about today, mainly they do two different things. They are going to prevent ovulation, which is the release of eggs from the ovaries. Those eggs, of course, have to interact with sperm. The sperm has to make contact with the egg in order to fertilize it and create a zygote, which later turns into a fetus and then a baby. Then we have another mechanism of action, which is just changes the consistency of cervical and uterine mucus, which make it harder for the sperm to penetrate. So we basically do birth control in two different ways, either by preventing ovulation, changing the consistency of the mucus and making it harder for the sperm to move to the egg, or a combination of those two. Now, it's important also to note that no contraceptive method is 100% effective, so it's always important to take precautions. What might those precautions be? Well, we have plenty of contraceptive methods. Now, many of these you're probably familiar with. There are condoms, female condoms. There's intrauterine devices, so you may have heard of those. Some of them can be surgically implanted. Some of them are inserted just like a hormonal ring, which is also inserted into the vagina as well in order to prevent that fertilization. There's also injections available, surgical sterilization as well. That would be like a vasectomy for men. There's implants, there's simply practicing abstinence, and then there are physical ways to actually block or begin or to track when a person might be fertile or non-fertile. Multiple contraceptive methods, but of course today we are mainly focusing just on the pharmaceutical ones. Now, oral contraceptives are what most people think of when they think about contraception or the pill, right? So combination oral contraceptive pills usually come in packs, like you will see something along the lines of that, or sometimes they're in this circular device as well. Now, they have 21 active pills in them, and I should say the majority of them do. Sometimes there are varying active pills versus inactive pills, but usually what you see are 21 active pills and 7 inactive pills. Now, why would we be giving people a prescription that is literally just a sugar pill? Well, the inactive or placebo pills are given to allow the body to have a normal menstrual cycle while not breaking the habit of taking a daily pill, which makes a lot of sense when you think about it, right? Because if you are on birth control and you get into the habit of every 3 weeks, you have to take these active pills to maintain that contraceptive effect, it might be difficult or it might be easy to forget a day if you suddenly stop taking those pills for a week. So what do? They give the inactive pills, which allow to have a normal menstrual cycle, which number one shows and allows the woman to know, well, I'm really not pregnant. So that's good to know. The contraceptive is working, as well as it being a little bit more healthy for the body as well in general to experience a menstrual cycle and go through that normal period of time. Now, many oral contraceptives must also be taken at the same time every day in order to have a full efficacious effect. You have to only take one pill, even if you missed more than one. It's very important not to double up on those pills. Now, certain oral contraceptives have a bit more leeway than others if you forget to take them. That window of time might be if you take it within anywhere between 3 to 12 hours of when you took it the previous day. So ideally, if you take your birth control at 8 a.m., you're always taking it at 8 a.m. However, for many pills, as long as you take it within, say, a 3-hour period of 8 a.m., so say you wake up late one morning, you take your birth control for one day at 8 a.m. and another day at 10 a.m., you're still going to get that contraceptive effect. However, if you forget and you take it later in the day, say you take it maybe at dinner time and you say, oh, no, I just forgot my pill. That's when you're going to want to use other methods of contraception as well, because it cannot be completely guaranteed that that contraceptive method that you're using, depending on the medication, is going to work perfectly well to the same level of efficacy to maintain that contraceptive effect as it would if you had taken it at the exact same time each day. Now, we have examples of combined oral contraceptive pills. So I will preface this by saying there are a ton of different types of birth control pills, and not even in pharmacy school do you usually have to memorize what each one of them is called. I remember we had this gigantic chart of just all of the different birth control pills and all their associated side effects and everything, because there are literally dozens of birth control pills that are different, just combinations of estrogen and progestin. That being said, the most common ones that you're likely to see are drospirenone and ethinyl estradiol, otherwise known as Yasmin, and others. And then we have norgestimate and ethinyl estradiol, which are again a combination medication. You might be familiar with those as Sprintec, orthotricycline, Trinessa, or others. We also have the option of progestin-only pills. Those are the ones that only contain progestin, and that most common one you see there is norethindrone or Micronor. So, important notes on contraceptives. Well, number one, they do not prevent the transmission of sexually transmitted diseases. So that's important to remember. Even if you're using contraception, that doesn't necessarily mean that you will not have a sexually transmitted disease based on the risk that you're having with your partner or what have you. It can be still, the contraceptives don't have any sort of antibiotic or antiviral effect in that regard. Now, most contraceptives, especially with estrogen, have a blood clotting risk. So this blood clotting risk is on any sort of list of side effects that you will see for those contraceptives. That being said, it's really not that common. So it's actually higher. There's a higher blood clotting risk in pregnant women in general than women taking hormonal contraceptives, to put that into perspective. However, increased estrogen and progestin might slightly increase the risk for deep vein thrombosis, which is that clotting in the legs in particular, pulmonary embolism and other clotting events, especially in women who have a history of cardiovascular diseases or disorders. So it's important to keep in mind with women who have a history of CVD or similar things, we want to make sure that they take the birth control that has the least chance of having any sort of cardiac event. Now, medication and supplement interactions are also very important with contraception, because the last thing you want with contraception is to be taking something along with it that makes it ineffective or not work. The biggest culprit that I would probably think that you may see on the exam would be St. John's wort. St. John's wort makes oral contraceptives ineffective through some fairly complex pharmaceutical reactions. It basically stops the contraceptive from working. Now, many medications might also interfere with the efficacy of contraceptives. So that's when you would want to use different contraceptive methods. That might be preferable. So you might want to simply recommend using condoms, using hormonal contraception that might be a little bit more effective, especially if they have to take certain medications that are essential, but they still want to have that contraceptive effect. Now, side effects of contraception, it's a hormone. You're administering hormones to people. So people naturally might get a bit hormonal. So that includes mood swings and changes, especially upon initial dosing. So especially when someone is first started on contraceptives, a lot of times they might go through mood fluctuations just as their body adjusts to having this new influx of hormones. Weight gain is also possible, and there are certain contraceptives that might agree with people more than others. So say if a woman experiences a sudden weight gain after starting a certain contraceptive, they can quite easily be switched to another type of combination pill or progestin-only pill, which might have a lower risk of weight gain. Now, another common thing is spotting between periods or breakthrough vaginal bleeding. A bit common with using birth control, but it's nothing to be too concerned about as long as that bleeding is not extreme and it doesn't cause any problems like anemia. Missed periods are also possible, which of course can be very concerning to people taking contraception because of course a missed period might lead them to believe that they may be pregnant. That being said, it is a normal consequence of taking hormonal contraception. Breast tenderness is also possible, as well as diarrhea and vomiting, and headaches and migraines are also commonly seen as complaints for people taking oral contraceptives. Now, people might not just take oral contraceptives to stop from becoming pregnant. There are actually a lot of useful methods or useful reasons why sometimes people are on oral contraception. And that could range from a variety of topics. So there's a decreased risk of ovarian and endometrial cancers, ovarian cysts, or other breast diseases for people using hormonal contraception. There's also sometimes an improvement in acne, even though it can sometimes cause acne. Sometimes it can also improve acne. It depends on the woman and it depends on the way the hormones are reacting within their body. Now, many people also simply take hormonal contraception and oral contraceptives because it causes less severe menstrual cramps or dysmenorrhea. It can also result in a reduction in androgen production, which is caused by PCOS. So for women with PCOS, which is just a hormone disorder related to their reproductive hormones, sometimes those contraceptives can be used to treat those symptoms and give them a better quality of life. It can also reduce heavy menstrual bleeding. Well, got that one out there. And also relieve PMS or premenstrual syndrome. So a lot of women, especially if they have bad or painful periods with heavy bleeding and they require or want fewer periods yearly, it can help moderate those periods and just give them better control of a monthly cycle. And even for women who are experiencing menopausal symptoms, sometimes they may be prescribed estrogen or other hormonal therapy in order to moderate those symptoms like hot flashes and perimenopause. Now, we have two other types of contraceptives that we should talk about today, and that is our Ortho-Evra and NuvaRing. So you may have heard of these. Ortho-Evra, or and bear with me as I try to pronounce this, norelgestromin ethinyl estradiol. There we go. It's a transdermal patch, meaning that estrogen and progestin is absorbed through the skin. You can see it's right there on this lady's back, and you can put it right there. Now, it's placed on the skin weekly for 21 days or 3 weeks, and there's no patch on the 4th week, and that allows for menstruation. So just like how we have those placebo pills for the oral contraceptives, we also have no patch for that 1 week period, and that allows them to go through their menstrual cycle and to take a break from that constant stream of estrogen and progestin. Now, it works the same way as the birth control pills. They inhibit ovulation and thicken the cervical mucus to prevent the sperm from reaching the egg. So two-tiered approach, right? So it stops the woman from ovulating, it stops those eggs from being released, and it also thickens the mucus so the sperm can't reach the egg to fertilize it. Now, it has a slightly higher risk for blood clots than the oral contraceptive option. However, it has similar hormonal side effects, just as the ones we went over. That being said, if the woman doesn't have a cardiovascular risk, she could benefit from Ortho-Evra, no question. And she might prefer that, especially if she has a very busy schedule and she might not be able to take that pill at the same time every day regularly. That's when you might want to recommend that patch. Similarly, we have etinogestrel ethinyl estradiol, or NuvaRing. Now, that is a flexible latex-free, it's latex-free, so it's good for people with latex allergies, plastic vaginal ring, and it's inserted in the vagina for 3 weeks. You remove after those 21 days to allow for menstruation. Again, just like Ortho-Evra, just like those oral methods. And the big thing with this one, you refrigerate it before dispensing. So it comes in these little pockets, these little packs, and you just keep those in the fridge in the pharmacy. Now, it's not recommended, again, for women with a history of blood clots, cardiovascular disease, or stroke. However, it is, again, a very, very good option for women who might be busy or not be able to keep to a schedule of taking a pill every single day, because you simply place it, leave it there for 3 weeks, and then remove after 21 days to give it that option for menstruation. Now, that's just about all for our oral and other contraceptives. Thank you very much. And as always, if you have any questions, feel free to contact me.